think obviously when we talk about innovation, I think we need to think not just about products, but also innovations in terms of how care is delivered and care processes. And so I'm going to focus actually on non-products, and the three innovations I would talk about, I would call them innovations because although people have been speaking about them for a long time, they're still at their infancy in terms of implementation. So the first one I would say is cancer nurses, specialist cancer nurses. In the UK, on the basis of a patient survey, the Cancer Patient Experience Survey that's conducted annually, it was found by patients that the most important thing that they wanted was to have a cancer specialist nurse accompany them in their care. And again, taking data from the UK, it's found that having a cancer nurse can reduce the overall cancer expenditure by 10% and have innumerable positive consequences in terms of outcomes, quality of life, and the whole experience of cancer care, really measured in any way possible across all cancers. So I would say the first thing is that every single cancer patient ideally should have a cancer nurse, and that role needs to be funded appropriately, and that training of that role needs to be recognized within different countries and across different countries. The second thing is certainly not original, but it's data. And I would say actually data, we talk a lot about data and we see all kinds of exciting data solutions being developed. But finding a way for patients to actually use their data and help themselves with that data, and that data becomes a discussion point between the patient and their care team, I think is the real innovation in the future. So moving from an app to that app being a starting point for discussion between a doctor and a patient, or a nurse and a patient. And the third innovation that I think is absolutely critical, and again has been talked about for a long, long time, is multidisciplinary care. And two things about multidisciplinary care: the patient and their family have to be the center of that multidisciplinary care team. And it has to reach beyond the team at the hospital, but also to encompass primary care, potentially ancillary care professionals who can also make a huge contribution to the outcomes of that patient. And that, I think, the implementation of true multidisciplinarity still remains an important challenge in cancer care. I feel that in the field of cancer, we are at probably one of the most exciting times possible, where all the talk previously about the fight against cancer or finding a cure for cancer is actually a possibility in our reach. I think the biggest challenge that we have to remember is that although for some cancers or for some patients we can find curative solutions, for others it will be a question of improving the quality of their life for as long as possible, but we will still not be able to offer them a cure. But also we still need to meet the needs of patients who will live with cancer, sometimes for many years, sometimes maybe for a very short period of time, and not lose sight of areas which have been talked about for a long time, like adequate pain control, palliative care. These are integral parts of success, of innovation, of improving outcomes. And really, to improve cancer care for all, we need to look at that whole system of care and look at innovation as part of the system of care and not just as the only goal that should be looked at in isolation. I think something that has been very exciting also in the cancer field has been the development of multisectoral partnerships, particularly where industry has played really a pioneering role in different countries and at an international level in gathering different stakeholders together. And obviously the most important stakeholders there are patient organizations. And I think the patient organizations and the patient community has also developed considerably in terms of their role. Their role isn't just advocacy. Their role is in shaping changes in cancer care that can really make a difference to their experience. No one can replace the patient ever in a discussion about how we should improve cancer care. And I think there are countless initiatives out there where patient organizations are either acting as the linchpin, the coordinator of really impressive multisectoral examples or multisectoral activities aimed to improve cancer care. And often this is in partnership with industry. And I'm just going to cite one example which I have had the honor of being involved in, which is called AllCan.